Alan, I'm truly at a loss for words to try to express how deserving, in my opinion, you are of this very, very coveted award. I mean, it's not every day that you get voted most likely to succeed.
Well, Dr. Roussell is a very caring person, and if you can get by his personal hygiene habits, you'll find that he's really fun to be around.
He's very witty, very sharp, and very lighthearted. More of a friend than somebody to work for. We've had a great time.
I'm Alan Roussell. I'm a department head of large animal clinical sciences at Texas A&M University. By trade, I'm actually a cow doctor. I became board certified in 1985, and back then there was one ACVIM for all species, and I was boarded in internal medicine.
Alan has served as a role model for a lot of us, not just me, but for a lot of people as well, and that being of excellence, excellence in patient care, teaching, research, and leadership. His leadership skills have been outstanding.
I have lots of stories, most of which I can't say on camera, but he's a great teacher and a great role model for a teacher, both in the clinic and in the lecture theatre as well. He's tough. He commands a lot of respect. His exam questions are really hard because I had to take them as a resident.
The main thing I would say about Alan is that I remember coming here as a resident, and from the time I arrived here, Alan was so deeply committed to the ACVIM, the organization, what it means to the profession.
ACVIM was something that I couldn't even spell when I was a student. We had some diplomates, but I didn't realize what it was and what they were, except I was very impressed with the people. Then when I started going to the forum and learned what ACVIM was, I was immediately attracted to the level of science and the level of patient care that internists displayed.
He was a very supportive mentor for me when I was interim department head for small animal, which was sort of like taking over a plane in mid-flight without much instruction on how to fly the plane. And he helped me fly the plane, and I think a lot of people probably don't realize that Alan took a lot of his own time to help mentor me, give me lots of advice, and kept the small animal plane going while he was keeping his large animal plane going over here.
One night, Dr. Roussell was working emergency and called me in to do a goat C-section. By the time I got here, he had already done it himself. I think he was just trying to be expedient to get the kids out, and he did a fine job. But that kind of stands out in my mind as a kind of an action guy that he is.
I think Dr. Roussell's legacy, both at Texas A&M and with the ACVIM, would have to be his work expanding the scope of both institutions internationally. His deep European ties, he's really been able to really globalize both institutions with regards to our specialty, and has really given us the opportunity to collaborate with individuals in Europe, for us to go to Europe and learn from them, for them to be able to learn from us. And I really think that the value of that can't be overstated.
I really enjoy my job. I have a colleague here that says he hasn't worked a day since he's been here, and he doesn't want anybody to find out because he comes to work every day to have fun, and he's a very productive person. I feel that way most days, particularly before I was in administration. I've always liked cattle. I've always liked students. I've always liked the challenge of medicine, and those things keep me going.
Congratulations, Dr. Roussell. You deserve this award.
Congratulations, man.
Congratulations, Dr. Roussell, on this prestigious award. I just want you to know that you've been a mentor to myself and many, many people in this room. I consider it an honor to be able to present this award to you.